There is lots to discuss, so let's get to our panel. Joining me now from Reno, Nevada is medical doctor Harry Hull. He is an expert in infectious diseases with over 35 years experience. With me here in the studio is Nicolas Veron. He's a senior fellow with the Petersen Institute for International Economics. Joining us too via Skype from Beijing is Victor Gao. He's an international relations expert and current affairs commentator. And with us in the studio as well is John Sitilides. He is a government affairs specialist and consultant to the US State Department. Welcome to all of you. Harry Hull, let me start with you in Reno, Nevada. There are now over 1,500 cases in the United States. Dozens of people have already died. We heard President Trump announce this travel ban restricting flights from Europe. What kind of impact will it have? And what's the point of having a travel ban when you exclude a country like the United Kingdom?
I think that the travel ban is counterproductive. I think that the federal government needs to focus on containing the outbreak in the United States, developing testing capacity. I mean, right now we have cases in nearly every state, and trying to stop it coming in from Europe when it's already here doesn't make sense to me.
And what about the point of leaving out the United Kingdom, flights from there? There's a lot of cases in the United Kingdom. In fact, there's more in the United Kingdom than there is in continental Europe.
Well, I don't understand the rationale at all. I wish our president was providing better leadership.
Okay, Nicolas Veron, at least 1,000 people have died in Italy. It remains the hardest hit country in Europe. In fact, it's in virtual lockdown right now. How critical is the situation there?
Well, it's pretty bad, but one can say Italy is behind the curve because they have started taking measures after the epidemic had reached a critical proportion, at least in some regions, but they're also ahead of the curve because the drastic measures they have taken are the way to go probably for other countries and are actually serving as a model for an increasing number of countries in Europe and around the world. So that's a very sobering experience. Many hospitals are at the limit of their capacity or beyond the limit. They're setting intensive care facilities in corridors and things like that. It's difficult to build a hospital in a week when you're not China. Mm-hmm. So that's basically the situation, which is evolving, but with I think a high degree of solidarity in the Italian public, but difficulties to enforce severe lockdown measures in a country where much of the government is decentralized and people have capacity to make their own decisions.
That's a key point, that everybody's got to be on board. They've got to help each other. So in Italy, what's happened, Nicolas, is that they have restricted movement and they've also restricted gatherings. That's
right. It's a country with what political scientists would call high levels of social capital. So there is a lot of peer pressure. People are learning from each other. And I think there is more discipline maybe than meets the eye in that respect. But it's still very early to get a sense of how the population in general, and especially in hotspots where the virus has already made inroads, how this is going to develop.
All right, let's go to Beijing, to Victor Gao. Victor, great to see you. What's the latest from China? We know that President Xi Jinping did visit Wuhan earlier this week. And we also heard that the number of infections has dropped pretty drastically in China. Do you sense that there is a turning point right now?
Absolutely. We expect to have a turning point very soon. Other than Wuhan, in the rest of the cities in Hubei province, as well as in other parts of China, the newly confirmed cases are dropping down like a rock. And in many provinces and municipalities there have been no more newly confirmed cases anymore for quite a number of days in a row. Even in the city of Wuhan, the newly confirmed cases are dropping down to single-digit numbers. That means China, through this very heroic and unprecedented fight against the coronavirus, is really gaining the upper hand. And it also symbolizes that once the government and the people and society at large can be mobilized and do a heroic fight against the coronavirus, this epidemic, or now this pandemic, can be brought under control. Cooperation throughout China is absolutely important. Cooperation between China and rest of the world is absolutely important. Therefore, I think one lesson we can show the world is that this is not a time for panic. This is a time for solidarity. Virus does not discriminate against one country versus another.
Right.
Virus is the common enemy of mankind. We need to get united to fight against this common enemy.
Victor, just one point. Is the quarantine still in place in that area or that region around Wuhan?
Yes, in Wuhan, I think the quarantine, the lockdown still continue. This is mainly to prevent any possible new flare-up of the coronavirus. And also, I think, the measures are very thorough. Most of the people are under lockdown in their own homes.
Right.
And community workers have been mobilized to do shopping for them, to send the shopped goods to their households, for example, so that there will be minimum movement of the people around in the city of Wuhan. And I think when President Xi Jinping was in Wuhan, he praised for the sacrifices made by the people of Wuhan, because they are making all these sacrifices not only for Wuhan, but for China as a whole, but also, more importantly, for the rest of the world.
Okay. In fact, while you were talking, Victor, we were looking at pictures taken by a drone of the city of Wuhan. John, let's get back to the United States. The President Trump, made a primetime address to the nation on Wednesday night. He sought to rally the country. Let's listen to part of what he had to say.
The virus will not have a chance against us. No nation is more prepared or more resilient than the United States. We have the best economy, the most advanced healthcare, and the most talented doctors, scientists, and researchers anywhere in the world. We are all in this together. We must put politics aside, stop the partisanship, and unify together as one nation and one family.
So, John, the president has been criticized for not doing enough and not having a response plan in place. But what about his call for putting politics aside as America tries to deal with this?
Well, this is an American issue, and it's a global issue, as our colleague just mentioned. But from a U.S. government perspective, there really is no Democrat or Republican when it comes to dealing with this pandemic. We need to come together as a nation, and this is the essence of what presidential leadership should be about. So no matter who the president is, when you have this type of a crisis affecting the country, it's important to reassure the American people, to provide a cool, calm, subdued, yet urgent message that something very difficult is in fact upon us. And we're going to have to work together as Americans. We're going to find ways to work with leaders around the world to ensure that we have best practices to see what we can learn from South Korea, from China, from Italy, what mistakes were made in countries like Iran. And how do we ensure that, from an American perspective, first of all, the American president's #1 job is to take care of the American nation, the American people, but along those lines, global pandemic, we've got to collaborate to the best extent possible with leaders and achieve best practices worldwide.
Yeah, John, in terms of reassuring the country, do you think President Trump did that last night?
I think we'll have a better sense in the next few weeks, because we are still in the most polarized political environment in modern American history. So unfortunately, no matter what he's to say, whether one supports him or not, 40% of Americans loathe him. So it's very difficult for them to overcome that sense. And then I think the people who support Donald Trump are going to give him the benefit of the doubt. If it looks like we're moving in the right direction, somehow flatten the curve of the infection increases and minimize the extent of the infections and the depth of the number of infections. But if he's failing in several months, and it looks like there were a number of mistakes, like, for instance, the lack of sufficient tests, and that becomes a pronounced problem, he may lose support within his own hardcore base. Right.
Harry Hull, John hit upon an important thing there, and that is testing. There's been criticism over the lack of testing in the United States. Even the head of the NIH, Dr. Anthony Fauci, admitted that the system is failing. This is what Dr. Fauci had to say. Let's listen to it.
The system is not really geared to what we need right now, what you are asking for. That is a failing.
And a failing, yes.
It is a failing. I mean, let's admit it. The idea of anybody getting it easily, the way people in other countries are doing it, we're not set up for that. Do I think we should be? Yes, but we're not.
So, Harry, very candid words there from Dr. Fauci, but if we contrast the levels of testing in places like China and South Korea, why has there been no testing at that level being done here?
Well, the primary testing up to this point has been through the public health system, and CDC is more of a research institution rather than a production institution. I think really what we needed early on in the outbreak was leadership from the Food and Drug Administration to promote development of laboratory testing capacity in the private sector. We also have to deal with the issue of the fact that we have a large uninsured population, and getting every insurance company to provide testing for free is terribly important. We're concerned about what do we do about the homeless who have no insurance? What do we do about the underinsured people who can't afford to pay for testing or even afford to pay to go to a doctor? So I think that this really is going to be a call for improvements in the health insurance system in the United States.
And just on the question of the distribution of testing kits, Harry, we heard Vice President Pence tell us earlier on that there would be something like between 1 million and 4 million testing kits being distributed around the country in the next few days. Do we know if that's helping at all, or has that happened?
I don't know for sure. I've not heard that that quantity of testing is available. I hear complaints that it's not easy to get a test at this point in time.
Nicolas, you were talking about Italy earlier on and its ability to deal with this. When it came to things like testing, medical equipment, hospital beds, I mean, were they overwhelmed initially?
I don't know the details, but they have done more testing earlier on, I think, than has been done in the US. So the difficulty in Italy was that the virus spread very rapidly. Very early on in the process, and I think the reaction, compared with other nations, the reaction of the Italian authorities has been actually quite quick, but they've been taken a bit by surprise. We heard from President Trump that the U.S. was the best prepared nation in the entire world. I think these are very humbling times for all public decision makers because the virus is ruthless.
Yeah.
It's not discriminating. As has been said before, it doesn't have a nationality. And as somebody who lives in the US, has lived in the US for 10 years, I very much hope the president will be proven right, but I think we'll see what happens in the next few weeks.
John, that's a key point, isn't it? Governments, even groupings like the EU or NATO, might have plans for almost every single contingency. But in this case, nobody seems to have had a plan somewhere.
One of the great folk stories here in Washington, Anand, is that the United States military has a contingency for invading almost any country in the world in a worst-case scenario, such as even Canada or Mexico, God forbid. But the question is, with all of the pandemics that we've seen around the world over the last 2 decades, out of the Middle East, out of China, out of Africa, out of different parts of the world, why wouldn't federal agencies here and in every advanced country not have a pandemic plan, an emergency plan to put into place? That's not a completely perfect format because each virus is different, but a larger system in place so that we have testing, we have notification, and we have the proper procedures for each different culture to be able to respond. Because I don't know that you can replicate in the United States the kind of lockdown of hundreds of millions of people like you have in China, or even as you have in Lombardy in Italy. It's a very different American culture.
Right.
And lockdown here smacks of martial law to a lot of Americans. So we have to be very careful how we balance out very important social conditions that minimize the spread, the community spread of the virus, with upholding the civil liberties of the American people.
Although people here are coming around to the view that they're going to have to make some sacrifices. We're seeing travel being restricted, people taking precautions when they're traveling around. Of
course.
A lot of gatherings have been stopped as well. Victor Gao, China, of course, has been praised by the World Health Organization, the WHO, for its response to fighting the coronavirus. And as we see the rest of the world trying to come to grips with this struggle with this virus, is there some way China can use its experience, its expertise in other parts of the world?
Absolutely. China has already, upon the request of the Italian government, sent a medical specialist team together with all the medical supplies and they have arrived in Italy, and they have been welcomed by Italy. And I hope this can be done in other countries. For example, if the United States government really shows sincerity and equality, for example, and asks the Chinese government to share its knowledge base, its expertise, and as well as its know-how, for example, in fight against the coronavirus, as well as the medical expertise, doctors and nurses, for example, I believe the Chinese government will be very happy to do that. And this will be good for the people of the United States, but also this will be good for China as a whole. So in this sense, I think China can really share its own expertise and lessons, for example, with many countries in the world. And also, each country is different, each political system is different, that's for sure. But for example, in the United States, if someone has a cough or has developed a fever and he goes to a hospital, if you do not change the process or the procedures in the hospital, that patient or potential patient, by the fact that walking into a clinic or hospital, may infect many other innocent people, including administrative staff, medical staff, or other patients, for example. Therefore, in a crisis like this, you really need to have new model of operations so that everyone will be on the alert and look for the suspected cases. And testing is absolutely important, and quarantine is also absolutely important, because otherwise this infection may go on and on, infecting many, many people.
Yeah, in fact, procedures would have to change. We've seen that in South Korea, in fact, where they were carrying out tests while people were still in their car for that very reason that you mentioned, Victor, to prevent people in an emergency room from getting the virus if someone walks in with a cough or a temperature of that kind. John, we talked earlier on briefly about the politics of this. And as President Trump said, look, let's put politics aside, but that's easier said than done. The man he's probably going to face in the presidential election in November is Joe Biden. Joe Biden's been talking about the coronavirus outbreak, and this is what he had to say.
Public fears are being compounded by a pervasive lack of trust in this president, fueled by adversarial relationships with the truth that he continues to have. Our government's ability to respond effectively has been undermined by hollowing out our agencies and disparagement of science. And our ability to drive a global response is dramatically undercut by the damage Trump has done to our credibility and our relationships around the world.
So it's already become a big partisan issue, hasn't it?
Well, it's not surprising. I mean, we may have a pandemic on our shores, but we also have a U.S. presidential election, and this is where you play hardball in the big league. So none of this is a surprise. And I think to a large extent, President Trump may confound his critics and shy back from the kind of normal responses, right? You punch him, he punches back twice or 10 times harder. I think it's going to be a little bit of a struggle for him to stay above the partisan politics, like these kinds of criticisms that are expected in a presidential race. So I don't see this becoming a major issue right now. Now, if this becomes a very serious health crisis in America in a few weeks, then you may see all sides pulling back from the kind of partisanship that's still fresh and raw right now. So we'll see where we are in several weeks and see if that changes the tenor of the debate.
Right, circumstances may force people to come together. Yeah, Harry Hull, one other thing we've been hearing about, the German Chancellor, Angela Merkel, she gave us a very sobering assessment of how the coronavirus is expected to impact a country like Germany. Let's listen to what she said.
Given a virus for which there is no immunity and no immunization, we have to understand that many people will be infected. The consensus among experts is that 60 to 70% of the population will be infected.
So, Harry, we're talking about millions of people there. I think it's something like 50 to 60 million people being infected in Germany. Is that a worst-case scenario that she's talking about? I mean, can one make these kinds of projections at this stage?
Well, I think that we're dealing with a totally unknown situation. I think that her projections are entirely feasible. I mean, one thing that we have to keep in mind is that a lot of the disease here is mild, that it can't be distinguished from a common cold or the influenza that is circulating all over the northern hemisphere at this point in time. And in addition to that, there are people who have no symptoms who are carrying the virus and are still capable of spreading it. So we may see 50, 60 million people infected in Germany, but keep in mind that not all of them are going to end up in the hospital. Not all of them are going to need to be in the intensive care unit or be on a respirator or die. So I think that we globally don't have a full grasp of how widespread the infection is, and we're just coming to the grips with that in the United States and elsewhere. And to me, it will be interesting to see if we can measure how much what I would call subclinical illness there is in China at the present time. Clearly, the number of the steps taken by the Chinese government has reduced transmission completely, but it's not stopped it totally, and we'll have to see how many mild cases are out there and if transmission continues.
Go ahead, John.
I think at the root of much of this anxiety that we're seeing here in the United States and in Europe, and that many of our friends in Asia have suffered over the last several months, is all the mystery around this virus, right?
Yeah.
We still don't know exactly where it emanated from. We don't know many of the properties, and so we don't know how this is going to be affecting different populations. And I think that's going to be a pronounced problem going forward. Now, hopefully this will crest sometime in the near future, but we have no idea what awaits us. Right. And it's a very different environment, just here from an American perspective, than anything we've been accustomed to since the 2008 financial crisis. And I think we're all looking to see what we can do to avoid that kind of a prolonged post-crisis environment in the United States and worldwide, given the ripple effects on global commerce, on societies around the world, and severe disruptions to daily life for millions and millions of people worldwide.
Also, the fact that the experts are telling us that they don't think there'll be a vaccine in the works for at least, I mean, there's testing being done right now, but it won't be in the works for at least another year. Nicolas, EU officials are saying that healthcare systems like the National Health Service in Britain will be overwhelmed by this. What about the rest of Europe? I mean, are there systems in place to deal with something like this?
Well, there are some variations among member states of the EU. There are generally very high quality medical systems in European countries compared to global averages, but it's going to be a challenge. And as has been said, this is a challenge which also meets different cultures, mass reactions of public opinion. I think it's very early to say what these reactions are going to be. We see resilience of society so far in Italy, but this is going to be a test for every society, whether it's in the US, whether it's in China, as it has been, and in Europe as well. I think what is striking is how fast the situation changes. Remember, a month ago, China didn't look good. The US and Europe, by and large, did look good. Now we have a completely different picture. Right. What will the picture be in 1 month's time? Nobody knows. And this situation is just moving too fast for almost everybody.
Victor, I've just got about 30 seconds left. The economic impact on this will be great for China, not just for China, because it'll have a knock-on effect on the rest of the world. What do you expect to happen in the weeks ahead?
Well, in China, in the month of February, the nation lost a total of about 20 working days for the whole nation. You are talking about 1/12 of national growth. So therefore, the economic toll on Chinese economy is absolutely astounding. And I would say this will cause similar havoc for the rest of the world. Aviation industry will suffer a great deal, tourism, etc., hotel business, you name it. So we are in the unknown territory, and I think this is time for calls for international cooperation rather than pointing accusing fingers at each other. And international cooperation will be absolutely necessary for the whole world, for mankind to get out of the woods and move on to a better day.
And that's where we have to leave it. Thanks to all of you for being with us. That's it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for watching. Hello everybody, I'm Anand Naidu. If you enjoy the thoughtful, engaged discussions you see on The Heat, you may also want to subscribe to our podcast. It's appropriately titled The Heat. Twice a week we take a deep dive on world headlines, talking to experts, journalists and others. It's a fresh, focused and intimate look at the issues that matter most. Whether it's the Hong Kong riots, the latest Middle East conflict or US politics, the Heat podcast gives the clear context needed to understand both what's going on and why. And what's best, we come to you. Whether you're at home or on the go, you can find the Heat podcast just about anywhere podcasts are found. Just search The Heat CGTN. Have a listen today and subscribe. Thanks.